Let's talk about the shoulder today. The shoulder is a very versatile and very complicated group of joints. Yes, it's not just one joint, but the three different joints in play. Number one is the glenohumeral joint. That's the joint between the upper arm and the shoulder blade. That's commonly the one that you think is called the shoulder joint. The second joint is the one that's between the collarbone and the shoulder blade, also called the acromioclavicular joint. And the final one is the one that's between the shoulder blade and the thoracic cage. That's the thoracoscapular or scapulothoracic joint. So when the shoulder moves, all those three joints are in place, but you can make sure you can actually eliminate different types so you know which one is in play. In addition to the joints in the shoulder, there are the muscles that keep the shoulder in position. The muscles are, you got the trapezius, which is above just between the neck and the shoulder. You got the deltoid muscles, the big one over the shoulder. There's the rotator cuff muscles. That's a group of muscles underneath the shoulder blade and on the outside of the shoulder blade. There is also some bursae. These are fluid-filled sacs that you find in proximity to joints. They help in lubrication when you move. There are also ligaments that hold the joint in position. There are tendons that are attached to the muscles that move the joint. Any of those things can go wrong and lead to pain. The muscles, the bursa, the tendons, the ligaments, or the joints themselves. So when someone is examining you, they will eliminate structures one by one until they get the one that's responsible for your pain. Once they know the structure that's responsible for the pain, they will then be in a position to work out the pathology, in other words, the kind of disease process or injury that's taking place, and therefore be able to institute a treatment protocol. Because of the complexity of the shoulder joint, the three joints, sometimes it can be very difficult for someone to know what structure is causing your pain. That's where you need an expert to be able to identify the structure for you and treat it. Investigations. Well, investigations are quite important in musculoskeletal medicine, but they're not as important in other forms of medicine. Most of the time, the clinical examination is what's going to lead to proper diagnosis and proper treatment protocol. Investigations are just helpful in proving what you already suspect, or if you're considering surgery, they can help the surgeon in deciding the surgical technique that is best to deal with your problem. I think basically I'll just stop. Okay, the kind of conditions you'll have, you can have a muscle strain, you can have a ligament strain, you can have a tendon strain, you can have tendon inflammation, a tendonitis, you can get inflammation of the vessel, a bursitis. You can also get an inflammation of the joint itself, an arthritis, or in the early stages, synovitis. So if you've got any shoulder problem, please get in touch with me. Often the pain that you feel in the shoulder does not originate from the shoulder itself, but comes from the neck. Therefore, the examiner may seem to examine your neck, just to eliminate the neck as the cause of your shoulder pain. Enjoy your day.